Hello, I'm Dr. Zakaria from Fixmarsh Surgery. I'm going to talk about the GP surgery access. In other words, how to get the best out of your GP practices. So traditionally, we know that GP practices can be accessed via the telephone and face-to-face, i.e. you can turn up in the GP practice reception. Out of these two methods, over the last 10 to 15 years, there are new ways to access GP practices, such as online access or through the app. So we're going to talk about those apps in a minute, but initially we would like to focus on telephone and face-to-face. So telephone services has been modernized now, so what it means is, like, if you want to reach us through the telephone in the morning, the busiest time, there may be 100 or 200 people trying to reach us. You'll be in the queue. And if you're in the queue, you can either leave a voice message or you can press a button to retain your position, and there will be a callback system. So we use a modern telephony system which enables you to keep your position. Although telephone is the most convenient way to communicate, but as you can imagine, everybody wants to do this way, and it can become a bit of a congested service in the morning. So if you would like to talk to us about something which is not urgent, you can call us after 10 o'clock in the morning. The other option is to use online services, which I'll discuss it in a second. Now, face-to-face, you can always come to us to talk to us in the front receptionist here, who can navigate to you to the right services. Now, the next slide is about how to use online services. The first one on the right hand side, as you can see, go to our GP practice website, fixmarshsurgery.nhs.uk. A number of things that you can access through this. It could be administrative services, like you want to access to your notes, results, or you want to request a prescription or a fit note, and so on. There is also an online consultation service, which means there is an online, you can interact with this through the app or web URL service, and you can put your symptoms and it will direct you the best possible service that you need to go to, such as pharmacy, GP services, or accident and emergency services. And then we'll talk about pharmacy first, relatively new initiative, and NHS app. So let's go one by one. So I'm just gonna now go out of this screen and try and sort of show you our practice website. So on our practice website, as you can see, there are different tiles there on the right hand side. So if you click that reception button, you will see that you can request a variety of things through these buttons, through these tiles. Or you can go to the online consultation tile, and I'll talk to you about it in a second. For the purpose of practical point of view, this reception and inquiries and administration office, they are pretty much identical. So it is actually to provide you non-urgent communication methods where you can put your request through these tiles. The other buttons, the other tile may be useful for you is prescriptions request page, where you can actually request your prescription through online module. Online module is, if you press yes, it will take you to the online services, which is not NHS app, but our GP service system that we use, their system, where you can request your prescription if you'd like to do that. So I'll leave it to you to play with this. The other options that you have for your prescription is to go to the NHS app. Now, NHS app is, like as it says, application. You can download it through your Apple App Store or Google Play Store. And if you click that, it will tell you how many different things you could do. The most important one would be your repeat prescriptions. And the other one is you can actually manage your appointments. And to me, it's most useful thing to use NHS app to get full access to your GP record. We often get a request, can I have a printout of my blood test report or my medical notes for insurance and so on. So you have access to your notes. You can use it for whatever purpose you want to do. So this is a very valuable service. Now I'd like to go back to our practice website, which is the main place where you need to go to get all those informations. Now eConsult, which is very useful because it is a self-sufficient online toolkit where you can put your symptoms and it will tell you that what's the best place for you to go to. Again, if it is something emergency like heart attacks or stroke or bleeding or broken bones, then you should go to accident and emergency. Don't use this tile or eConsult. eConsult is for something that you are unsure what to do and it will interact with you. So if I click this button, it will take me to this page. If you're an adult, you click that and there are a number of different options in there. It gives you some information about different conditions. Let's say you know about this condition anyway and you just need to interact with it. So you can click this request others advice and then it will ask you whether you want to still contact your GP practice, which means that if you provide this form, it will come to us and if that decides this is the best service for you. So if I click that button and I say, well, I understand this is my GP practice and I'll provide you information and so on. And it could be for yourself. It could be for, it tells you that if you have those conditions, don't use this. And if it is something else, yes, you do that. So if you need to medical help now, then 999, but I actually put the wrong button. So let's say I'm not experiencing any of this issue. Is this your GP practice? You say yes. And you're a male, female, and so on. So you fill out this form and you can send information and this algorithm will decide whether they will send this information to the GP practice or you will be better off going to self-help group or maybe emergency department at the hospital. So this eConsult is very valuable and you can access it through an app. You can download this app and you can access it from your mobile phone easily if you don't want to go to the GP practice website. Now pretty much I have covered the online request, which you can request through this. eConsult, your companion to interact about your health problems and that can advise you, and NHS app. And finally, I was going to say that there are multiple services available through Pharmacy First. So if you go to the Pharmacy First website, it will tell you these are the conditions that the pharmacists, some of the pharmacists, or most of them probably in Mitcham, they provide to see those conditions. And there is the age group on the right hand side, as you can see. If you have earache, infection in the ear, then you can see them. The pharmacist will examine and give you antibiotics if necessary. This is a skin condition known as impetigo, infected insect bites, shingles, sinusitis, sore throat, uncomplicated urinary tract infection, women, not men, women only, 16 to 64 years of age. Now, these are the common conditions that people consult GP practices. Now, it is a government initiative to expand it to the clinical pharmacists who can really advise you on this. Now, If you don't feel confident to go to the pharmacy, you can always contact us, our front desk staff, receptionist, stroke care navigators. They can book you with any of your chosen pharmacists, and you can go and see them. And if necessary, they can advise you whether they can give you treatment. If not, they can always refer you back to us. So this is another service which is very popular now, and people are accessing their pharmacy services for a variety of things. And I think this would be really helpful for minor ailments. Now, going back to this Fixed Marsh Surgery website, we are developing this. So at the moment, most useful tiles will be reception and inquiries, e-consult, and prescriptions. And this prescriptions button will take you to an app which could be linked with the GP practice computer system, or you can use NHS app. It can be a bit confusing to start with, but I'm sure as we are moving towards online communications, there is no way to escape from it. If you imagine 20 years ago, we used to go to the bank to do our regular banking. I think 90% of people are now using app to do their financial transaction. And it is actually, we are probably in the healthcare following the footsteps of all the other industries where people are online based. It doesn't mean that we do shortcuts. It means that more convenience, and it's easier for you to access services. Also, you can you don't need to wait on the phone, or you don't have to come to the GP practices. You can interact with the system, with the facilities easily. Now, if you need to talk to us, by all means, do call us. These are not absolutely that you have to use it. We encourage people to use it. It reduces call burden to our reception staff, so that whoever, let's say someone who is very elderly, more than 80 years old or 85 years old, 90 years old, they may use this telephone service who is unable to use the online services. So I would request everybody to consider this. Hope you will take care of yourself in this cold December month. Hopefully I'll come back with more videos in the future. Thank you very much.